For this first technique, I'm using the back of a fist along the knuckles and dragging the tissue from the clavicle and the sternum up toward the mastoid process and utilizing contralateral rotation at the same time. This is a great technique to glide all the way back through the mastoid process and along the occipital ridge. I'm not as deep as the muscle belly, but really focusing on that superficial fascia. Next, we're going to utilize a pincer grip to compress both the clavicular and sternal heads of SCM. About midway up the neck, they merge into one belly, but you can compress and treat these tissues from just above the clavicle all the way to just below the mastoid process. For the next technique, we're simply taking our fingertips and raking the attachment on the mastoid process to relieve any adverse tension on its attachment at the occipital ridge. Transitioning now to scalenes, we have a middle, anterior, and posterior scalene. We're going to start here with middle scalene, and we're just doing a series of small pocketed glides and compression. Broad glides can be a little bit tough, so you'll see me remove my pressure and reinvest my pressure. We are right in those transverse processes, so contact should be right along the line of the external auditory meatus or ear. And then I'll transition to the anterior fibers, which will be in front of the transverse processes. You'll see me move forward and in, and then hook back into the front of those tubercles. And I'll be able to use a little bit more flexion and extension of the neck as I have a more secure position on those vertebral bodies. All right, here we're going to treat the attachments on the ribs. Just take a thumb directly into those ribs. A little bit of abduction of the shoulder creates a little more space in that thoracic outlet. And I'm compressing towards the feet of the client and rocking back and forth with frictions to treat those rib attachments on rib 1. So this is for anterior and middle scaling. You can sneak a little bit back into that attachment for posterior scaling as well. For posterior scaling, I like the client to be supine as we need to get to the posterior tubercles. I like the sweeping technique of going, so here I'm going down in front of trapezius and I'm sweeping or hooking up into the posterior side of the transverse processes or posterior tubercles. Remember, this is on the posterior tubercles of vertebrae 5, 6, and 7. So this is a very inferiorly located scaling. It's a very almost at the base of the neck. And then I am able to, if I want, add rotational motions to sort of stretch this tissue as I hold a pin on that posterior scaling. Here's a pin and stretch for the infrahyoids. I'm going to have the client tuck the chin down. I'm going to pin those tissues along the trachea towards the clavicle and then have our client or your client extend the neck to stretch these tissues. Here, I'm going to lift the head into flexion to slacken these tissues, and I'm going to attempt a pickup compression on the infrahyoids. This will be possible for those that have looser infrahyoids. You will not be able to pick up and compress everybody's. For those whose infrahyoids you cannot pick up, we're going to use one hand, the one on my right, to hold the trachea in place and the other to reach around to the left side and do cross fiber friction into the hyoids. They'll feel like little guitar strings along the trachea. So if you find a tight spot, as I have here, I can just hold the compression to get some deep release in that tissue. Okay, but as you go back and forth, you should feel these tissues pretty easily. And if you can find hot spots, just hang out there. It doesn't take a tremendous amount of pressure at all. For longus coli and capitis, I am using my right hand to lift the neck into flexion, head into flexion. I'm using my left hand to move this will be my treatment hand, move the trachea out of the way just a little bit, and then rotate the muscle towards me. Instead of moving the trachea a whole bunch, I'm really able to just move the front of the spine towards me. And now I'm heading towards the table to compress these muscles on the front of the vertebral bodies. If you're there, a little bit of neck flexion should fire them. So if they tuck the chin towards the chest, you should feel them contract. For some, this is going to be a very difficult way to treat them. So if you have good accessibility, great. If you don't have good accessibility, the next technique will work better. For most folks, this is my go-to. Seated, they're able to look down and create slack. Then I can hook in and contact coli and capitis from a seated position. This is not only a more accessible way to treat it, but I can utilize a lot more movement, flexion and extension, as well as rotational motions. But again, moving the trachea, having them go into flexion, and then compressing that tissue with fingertips.